I'm Julie Bartke with Session Update. A rally on Wednesday drew attention to the issue of HIV and AIDS and a plea to lawmakers to not have programs and services for this population cut as the legislature grapples with reducing $150 million in the Health and Human Services budget. That plea came in part in the form of stories by those afflicted with the virus.
I remember it was early in November and I went for my HIV antibody test. I had finally decided to test because there was legislation on the books in California that would have made anonymous testing illegal. Just before the election, many of us tested in order to take advantage of what might have been our last window for testing anonymously. My results came back positive from the first test, and the information for me was devastating, as one might expect. At the time, we had no medical intervention or treatment that could prolong our lives. The best we could hope for was to improve the quality of the lives we had remaining. During the years following, I watched a greater part of my community wither and die. Somehow, I was one of the people who survived. I used my graduate work in mental health to design and deliver programs encouraging people to engage in safer behaviors and to get tested.
I'm here to share my story with you so you may better understand how vitally important and necessary government funding for HIV/AIDS education and prevention, treatment, and research is to people like me. I was diagnosed with AIDS in September 2004 while undergoing treatment for chemical dependency. My initial reaction was to take my own life because I did not know or believe that there was any hope or chance of living a normal, happy life. The thought of a slow, humiliating death was more than I could handle. I was scared, and I had no idea where to turn or what was necessary to treat this devastating illness. Through RS Eden programs, the Minnesota AIDS Project, Hennepin County Medical Center, MNCHA, Program HH, and the Ryan White Fund, I was able to formulate a plan of action to treat my illness along with my chemical health. The last eight and a half years of my life have been nothing short of a miracle. Not only have I been able to establish a life of recovery free from drugs and alcohol, but I've also managed to make tremendous progress in managing my AIDS diagnosis. Although there have been difficult times, for the most part, I have been able to live a normal life. I'm not saying that living with HIV/AIDS is without its share of complications, social stigma, personal and emotional struggles, and uncertainty, but I am sure that I would not be alive today without the professional help I received.
They need to know that the numbers they're looking at on their spreadsheets in those committee hearings are not an abstraction. They're real lives, real consequence, real opportunity. And let me thank you all individually from the bottom of my heart for the amazing work so many of you had done for so long, over so many years, putting together the Minnesota AIDS Project and all the other community-based organizations that serve people where they live with the struggles that they have. That is so crucial.
HIV/AIDS Action Day at the Capitol is an annual event, and you can follow many of the events at the Capitol by following us on our Senate Media Services Twitter, YouTube, and Facebook accounts.